Good morning, everybody. My case is a 65 years old gentleman presented to me with a sub-ileum hemorrhage due to ruptured macroaneurysm. I decided to only follow up the patient, and over the course of 3 weeks, the sub-ileum hemorrhage completely resolved. But after 2 months, the patient presented again with submacular hemorrhage and recurrent sub-ileum hemorrhage. At this time, I decided to operate. I started by doing ileum peeling. But while I'm doing ileum peeling, the view got momentarily poor due to dryness of the cornea. At this moment, the view was not great, so I created an iatrogenic macular hole. This is the site of the iatrogenic hole. And now I am completing the ileum peeling to help in closure of this macular hole postoperatively. Then I'll try to manage the submacular hemorrhage by subretinal injection of TBA. Now I'm removing the sub-ileum blood using the flute needle and the cutter. But now the problem came. While injecting subretinal TBA, the TBA come from this iatrogenic hole. So I was not able to detach the macula. I tried at another location. Now you can see that the TBA is coming from this iatrogenic hole. And I think I should do a macular detachment in this case because there is a large area of organized blood. So I tried to create a bleb outside the area of the hemorrhage remotely, and I'm enlarging it slowly. But as I am enlarging this subretinal bleb, it was going peripherally away from the hemorrhage. So again, I was not able to detach the macula. I tried to create another bleb between this peripheral bleb and the submacular hemorrhage, trying to connect these two together, the bleb and the submacular hemorrhage, but again, I failed. So now I have the submacular hemorrhage, I have the subretinal bleb. Now at this moment, I feel stuck in my surgery. I was not able to connect them together. So I decided to just do an air fluid exchange, and the air will push the TBA towards the macula. And after doing air fluid exchange, now you can see that the area of the submacular hemorrhage is connected to the subretinal bleb. And I injected C2F6 gas. After surgery, the submacular hemorrhage was the same, almost the same. But you can see that the iatrogenic hole was closed. So I decided to follow up the patient. But after 1 month, the macula was detached. The submacular hemorrhage completely disappeared, but the macula was detached, and the detachment was extending beyond the lower arcade. And OCT scan passing through the area of the iatrogenic hole showed reopening of this iatrogenic hole. The patient was scheduled for a second intervention, but surprisingly, the retina was spontaneously reattached after 1 week. This happened the same day of surgery. I think this can be explained by the small clot of blood that was partially occluding the iatrogenic hole. Thank you very much.
Thank you.